Hmm?
Hi, Ruben here and welcome to Anatomy Movement, where anatomy becomes funatomy. We have summarized and detailed notes, acronyms, HD images to build your photographic memory, X-rays images, tabled notes and questions and answers at the end of each video to help you remember all that we have learned. Without further ado, let's dive into today's topic. Muscles of the upper limb. The muscles of the upper limb can be grouped in different regions. The regions include muscles of the pectoral region, muscles of the shoulder region, muscles of the upper arm, muscles of the anterior forearm, muscles of the posterior forearm, and finally muscles of the hand. Muscles of the pectoral region. The pectoral region is located on the anterior chest wall. It contains four muscles that exert a force on the upper limb: the pectoralis major, pectoralis minor, serratus anterior, and subclavius. In this video, we shall look at the anatomy of the muscles of the pectoral region, their attachments, actions and innervation. Pectoralis major. The pectoralis major is the most superficial muscle in the pectoral region. It is large and fan-shaped, and is composed of a sternal head and a clavicular head. Attachments. Clavicular head originates from the anterior surface of the medial clavicle. Sternocostal head originates from the anterior surface of the sternum, the superior six costal cartilages, and the aponeurosis of the external oblique muscle. The distal attachment of both heads is onto the intertubercular sulcus of the humerus. Function. Adducts and medially rotates the upper limb and draws the scapula antero-inferiorly. The clavicular head also acts individually to flex the upper limb. Innervation. Lateral and medial pectoral nerves. Pectoralis minor. The pectoralis minor lies underneath its larger counterpart muscle, pectoralis major. Both muscles form part of the anterior wall of the axilla region. Attachments. Originates from the 3rd-5th ribs and inserts into the coracoid process of the scapula. Function. Stabilizes the scapula by drawing it antero-inferiorly against the thoracic wall. Innervation. Medial pectoral nerve. Serratus anterior. The serratus anterior is located more laterally in the chest wall and forms the medial border of the axilla region. Attachments. The muscle consists of several strips, which originate from the lateral aspects of ribs 1 to 8. They attach to the costal rib-facing surface of the medial border of the scapula. Function. Rotates the scapula, allowing the arm to be raised over 90 degrees. It also holds the scapula against the ribcage. Innervation. Long thoracic nerve. Subclavius. The subclavius is small muscle, which is located directly underneath the clavicle, running horizontally. It affords some minor protection to the underlying neurovascular structures, e.g. in cases of clavicular fracture or other trauma. Attachments. Originates from the junction of the first rib and its costal cartilage. It inserts onto the inferior surface of the middle third of the clavicle. Function. Anchors and depresses the clavicle. Innervation. Nerve to subclavius. Quiz. What is the innervation of the pectoralis major? Medial and lateral pectoral nerves. Intercostal nerves. Long thoracic nerve. Thoracodorsal nerve. The correct answer is medial and lateral pectoral nerves. Muscles of the shoulder region. The muscles of the shoulder are associated with movements of the upper limb. They produce the characteristic shape of the shoulder, and can be divided into two groups. Extrinsic, originate from the torso, and attach to the bones of the shoulder clavicle, scapula or humerus. Intrinsic, originate from the scapula and/or clavicle, and attach to the humerus. Note: there are other muscles that act on the shoulder joint, the muscles of the pectoral region, and the upper arm. In this video, we shall look at the anatomy of the extrinsic muscles of the shoulder, their attachments, innervation, and actions. The extrinsic muscles of the shoulder originate from the trunk, and attach to the bones of the shoulder, the clavicle, scapula, or humerus. They are located in the back, and are also known as the superficial back muscles. The muscles are organized into two layers, a superficial layer and a deep layer. Superficial. There are two superficial extrinsic muscles, the trapezius and latissimus dorsi. Trapezius. The trapezius is a broad, flat, and triangular muscle. The muscles on each side form a trapezoid shape. It is the most superficial of all the back muscles. Attachments. originates from the skull, nuchal ligament and the spinous processes of C7-T12. The fibers attach to the clavicle, acromion, and the scapula spine. Actions. The upper fibers of the trapezius elevate the scapula and rotates it during abduction of the arm. The middle fibers retract the scapula and the lower fibers pull the scapula inferiorly. Innervation. Motor innervation is from the accessory nerve. It also receives proprioceptor fibers from C3 and C4 spinal nerves. Clinical relevance. Testing the accessory nerve. The most common cause of accessory nerve damage is iatrogenic, i.e. due to a medical procedure. In particular, operations such as cervical lymph node biopsy or cannulation of the internal jugular vein can cause trauma to the nerve. To test the accessory nerve, trapezius function can be assessed. This can be done by asking the patient to shrug his or her shoulders. Other clinical features of accessory nerve damage include muscle wasting, partial paralysis of the sternocleidomastoid, and an asymmetrical neckline. Latissimus dorsi. The latissimus dorsi originates from the lower part of the back, where it covers a wide area. Attachments. Has a broad origin, arising from the spinous processes of T7-T12, iliac crest, thoracolumbar fossa and the inferior three ribs. The fibers converge into a tendon that attaches to the intertubercular sulcus of the humerus. Actions. Extends, adducts, and medially rotates the upper limb. Innervation. Thoracodorsal nerve. Deep. There are three muscles in this group, the levator scapulae and the two rhomboids. They are situated in the upper back, underneath the trapezius. Levator scapulae. The levator scapulae is a small strap-like muscle. It begins in the neck and descends to attach to the scapula. Attachments. Originates from the transverse processes of the C1-C4 vertebrae and attaches to the medial border of the scapula. Actions. Elevates the scapula. Innervation. Dorsal scapular nerve. Rhomboids. There are two rhomboid muscles, major and minor. The rhomboid minor is situated superiorly to the major. Rhomboid major. Attachments. Originates from the spinous processes of T2-T5 vertebrae. Attaches to the medial border of the scapula, between the scapula spine and inferior angle. Actions. Retracts and rotates the scapula. Innervation. Dorsal scapular nerve. Rhomboid minor. Attachments. Originates from the spinous processes of C7-T1 vertebrae. Attaches to the medial border of the scapula, at the level of the spine of scapula. Actions. Retracts and rotates the scapula. Innervation. Dorsal scapular nerve. Quiz. What nerve innervates the trapezium muscle? Medial pectoral nerve. Axillary nerve. Accessory nerve. Thoracodorsal nerve. The correct answer is accessory nerve. The intrinsic muscles, also known as the scapulohumeral group, originate from the scapula and/or clavicle, and attach to the humerus. There are 6 muscles in this group: the deltoid, teres major, and the 4 rotator cuff muscles, supraspinatus, infraspinatus, subscapularis and teres minor. Deltoid. The deltoid muscle is shaped like an inverted triangle. It can be divided into an anterior, middle and posterior part. Attachments. Originates from the lateral third of the clavicle, the acromion and the spine of the scapula. It attaches to the deltoid tuberosity on the lateral aspect of the humerus. Actions. Anterior fibers, flexion and medial rotation. Posterior fibers, extension and lateral rotation. Middle fibers, the major abductor of the arm takes over from the supraspinatus, which abducts the first 15 degrees. Innervation. Axillary nerve. Teres major. The teres major forms the inferior border of the quadrangular space, the gap, that the axillary nerve and posterior circumflex humeral artery pass through to reach the posterior scapular region. Attachments. Originates from the posterior surface of the inferior angle of the scapula. It attaches to the medial lip of the intertubercular groove of the humerus. Actions. Adducts and extends at the shoulder, and medially rotates the arm. Innervation. Lower subscapular nerve. Rotator cuff muscles. The rotator cuff muscles are a group of 4 muscles that originate from the scapula and attach to the humeral head. Collectively, the resting tone of these muscles acts to pull the humeral head into the glenoid fossa. This gives the glenohumeral joint a lot of additional stability. In addition to their collective function, the rotator cuff muscles also have their own individual actions. Supraspinatus. Attachments. originates from the supraspinous fossa of the scapula, attaches to the greater tubercle of the humerus. Actions: abducts the arm 0 to 15-0, and assists deltoid for 15 to 90-0. Innervation: suprascapular nerve, infraspinatus. Attachments: originates from the infraspinous fossa of the scapula, attaches to the greater tubercle of the humerus. Actions: laterally rotates the arm. Innervation: suprascapular nerve, subscapularis. Attachments: originates from the subscapular fossa, on the costal surface of the scapula. It attaches to the lesser tubercle of the humerus. Actions: medially rotates the arm. Innervation: upper and lower subscapular nerves. Teres minor. Attachments: originates from the posterior surface of the scapula, adjacent to its lateral border. It attaches to the greater tubercle of the humerus. Actions: laterally rotates the arm. Innervation: axillary nerve. The upper arm muscles. The upper arm is located between the shoulder joint and elbow joint. It contains 4 muscles, 3 in the anterior compartment, biceps brachii, brachialis, coracobrachialis, and 1 in the posterior compartment, triceps brachii. In this video, we shall look at the anatomy of the muscles of the upper arm, their attachments, innervation and actions. Anterior compartment. There are 3 muscles located in the anterior compartment of the upper arm: biceps brachii, coracobrachialis and brachialis. They are all innervated by the musculocutaneous nerve. A good memory aid for this is BBC, biceps, brachialis, coracobrachialis. Arterial supply to the anterior compartment of the upper arm is via muscular branches of the brachial artery. Biceps brachii. The biceps brachii is a 2-headed muscle. Although the majority of the muscle mass is located anteriorly to the humerus, it has no attachment to the bone itself. As the tendon of biceps brachii enters the forearm, a connective tissue sheet is given off, the bicipital aponeurosis. This forms the roof of the cubital fossa and blends with the deep fossa of the anterior forearm. Attachments: long head originates from the supraglenoid tubercle of the scapula, and the short head originates from the coracoid process of the scapula. Both heads insert distally into the radial tuberosity and the fossa of the forearm via the bicipital aponeurosis. Function: supination of the forearm. It also flexes the arm at the elbow and at the shoulder. Innervation: musculocutaneous nerve. The bicep tendon reflex tests spinal cord segment C6. Coracobrachialis. The coracobrachialis muscle lies deep to the biceps brachii in the arm. Attachments: originates from the coracoid process of the scapula. The muscle passes through the axilla, and attaches the medial side of the humeral shaft, at the level of the deltoid tubercle. Function: flexion of the arm at the shoulder, and weak adduction. Innervation: musculocutaneous nerve, brachialis. The brachialis muscle lies deep to the biceps brachii, and is found more distally than the other muscles of the arm. It forms the floor of the cubital fossa. Attachments: originates from the medial and lateral surfaces of the humeral shaft and inserts into the ulnar tuberosity, just distal to the elbow joint. Function: flexion at the elbow. Innervation: musculocutaneous nerve, with contributions from the radial nerve. Posterior compartment. The posterior compartment of the upper arm contains the triceps brachii muscle, which has 3 heads. The medial head lies deeper than the other 2, which cover it. Arterial supply to the posterior compartment of the upper arm is via the profunda brachii artery. Triceps brachii. Attachments: long head, originates from the infraglenoid tubercle. Lateral head, originates from the humerus, superior to the radial groove. Medial head, originates from the humerus, inferior to the radial groove. Distally, the heads converge onto one tendon and insert into the ulcranon of the ulna. Function: extension of the arm at the elbow. Innervation: radial nerve. A tap on the triceps tendon tests spinal segment C7. Note: in some individuals, the long head of the triceps brachii is innervated by the axillary nerve. Quiz: which nerve innervates the muscles in the anterior upper arm? Median nerve, axillary nerve, radial nerve, musculocutaneous nerve. The correct answer is musculocutaneous nerve. The muscles of anterior forearm. The muscles in the anterior compartment of the forearm are organized into 3 layers. Superficial: flexor carpi ulnaris, palmaris longus, flexor carpi radialis, pronator teres. Intermediate: Flexor digitorum superficialis. Deep. Flexor pollicis longus, flexor digitorum profundus and pronator quadratus. This muscle group is associated with pronation of the forearm, flexion of the wrist and flexion of the fingers. They are mostly innervated by the median nerve except for the flexor carpi ulnaris and medial half of flexor digitorum profundus, which are innervated by the ulnar nerve and they receive arterial supply from the ulnar artery and radial artery. In this video, we shall look at the anatomy of the muscles in the anterior compartment of the forearm, their attachments, actions, innervation and clinical correlations. Superficial compartment. The superficial muscles in the anterior compartment are the flexor carpi ulnaris, palmaris longus, flexor carpi radialis and pronator teres. They all originate from a common tendon, which arises from the medial epicondyle of the humerus. Flexor carpi ulnaris. Attachments. The flexor carpi ulnaris has two origins. The humeral head originates from the medial epicondyle of the humerus with the other superficial flexors, whilst the ulnar head originates from the olecranon of the ulna. The muscle tendon passes into the wrist and attaches to the pisiform bone, hook of Hamate, and base of the fifth metacarpal. Actions. Flexion and adduction at the wrist. Innervation. Ulnar nerve. Palmaris longus. This muscle is absent in about 15% of the population. Attachments. Originates from the medial epicondyle, attaches to the flexor retinaculum of the wrist. Actions. Flexion at the wrist. Innervation. Median nerve. Flexor carpi radialis. Attachments. Originates from the medial epicondyle, attaches to the base of metacarpals 2 and 3. Actions. Flexion and abduction at the wrist. Innervation. Median nerve. Pronator teres. The lateral border of the pronator teres forms the medial border of the cubital fossa, an anatomical triangle located over the elbow. Attachments. It has two origins, one from the medial epicondyle, and the other from the coronoid process of the ulna. It attaches laterally to the mid-shaft of the radius. Actions. Pronation of the forearm. Innervation. Median nerve. Intermediate compartment. The flexor digitorum superficialis is the only muscle of the intermediate compartment. It can sometimes be classed as a superficial muscle, but in most individuals, it lies between the deep and superficial muscle layers. The muscle is a good anatomical landmark in the forearm. The median nerve and ulnar artery pass between its two heads, and then travel posteriorly. Attachments. It has two heads, one originates from the medial epicondyle of the humerus, the other from the radius. The muscle splits into 4 tendons at the wrist, which travel through the carpal tunnel, and attach to the base of the middle phalanx of the 4 digits. Actions. Flexes the metacarpophalangeal joints and proximal interphalangeal joints at the 4 fingers, and flexes at the wrist. Innervation. Median nerve. Deep compartment. There are 3 muscles in the deep anterior forearm: flexor digitorum profundus, flexor pollicis longus, and pronator quadratus. Flexor digitorum profundus. Attachments. Originates from the ulna and associated interosseous membrane. At the wrist, it splits into 4 tendons, that pass through the carpal tunnel and attach to the distal phalanges of the 4 fingers. Actions. It is the only muscle that can flex the distal interphalangeal joints of the fingers. It also flexes at metacarpophalangeal joints and at the wrist. Innervation. The medial half acts on the little and ring fingers is innervated by the ulnar nerve. The lateral half acts on the middle and index fingers is innervated by the anterior interosseous branch of the median nerve. Flexor pollicis longus. This muscle lies laterally to the flexor digitorum profundus. Attachments. Originates from the anterior surface of the radius and surrounding interosseous membrane. Attaches to the base of the distal phalanx of the thumb. Actions. Flexes the interphalangeal joint and metacarpophalangeal joint of the thumb. Innervation. Median nerve, anterior interosseous branch. Pronator quadratus. A square-shaped muscle found deep to the tendons of the flexor digitorum profundus and flexor pollicis longus. Attachments. Originates from the anterior surface of the ulna and attaches to the anterior surface of the radius. Actions. Pronates the forearm. Innervation. Median nerve, anterior interosseous branch. Quiz. Where do superficial muscles of the anterior forearm originate? Olecranon of the ulna. Medial epicondyle of the humerus. Lateral epicondyle of the humerus. Deltoid tuberosity. The correct answer is medial epicondyle of the humerus. The muscles of the posterior forearm. The muscles in the posterior compartment of the forearm are commonly known as the extensor muscles. The general function of these muscles is to produce extension at the wrist and fingers. They are all innervated by the radial nerve. The muscles in this compartment are organized into two layers, deep and superficial. These two layers are separated by a layer of fascia. In this video, we shall look at the anatomy of the muscles in the posterior forearm, their attachments, actions and clinical relevance. Superficial muscles. The superficial layer of the posterior forearm contains 7 muscles. 4 of these muscles, extensor carpi radialis brevis, extensor digitorum, extensor carpi ulnaris and extensor digiti minimi, share a common tendinous origin at the lateral epicondyle. Brachioradialis. The brachioradialis is a paradoxical muscle. Its origin and innervation are characteristic of an extensor muscle, but it is actually a flexor at the elbow. The muscle is most visible when the forearm is half pronated, and flexing at the elbow against resistance. In the distal forearm, the radial artery and nerve are sandwiched between the brachioradialis and the deep flexor muscles. Attachments. Originates from the proximal aspect of the lateral supracondylar ridge of humerus, and attaches to the distal end of the radius, just before the radial styloid process. Actions. Flexes at the elbow. Innervation. Radial nerve. Extensor carpi radialis longus and brevis. The extensor carpi radialis muscles are situated on the lateral aspect of the posterior forearm. Due to their position, they are able to produce abduction as well as extension at the wrist. Attachments. The ECRL originates from the lateral supracondylar ridge of the humerus, while the ECRB originates from the lateral epicondyle. Their tendons attach to metacarpal bones 2 and 3. Actions. Extends and abducts the wrist. Innervation. Radial nerve. Extensor digitorum communis. The extensor digitorum is the main extensor of the fingers. To test the function of the muscle, the forearm is pronated, and the fingers extended against resistance. Attachments. Originates from the lateral epicondyle. The tendon continues in the distal part of the forearm, where it splits into 4, and inserts into the extensor hood of each finger. Actions. Extension of the digits at the interphalangeal and metacarpophalangeal joints. Innervation. Radial nerve deep branch. Extensor digiti minimi. The extensor digiti minimi is thought to originate from the extensor digitorum muscle. In some people, these two muscles are fused together. Anatomically, the extensor digiti minimi lies medially to the extensor digitorum. Attachments. Originates from the lateral epicondyle of the humerus. It attaches, with the extensor digitorum tendon, into the extensor hood of the little finger. Actions. Extends the little finger, and contributes to extension at the wrist. Innervation. Radial nerve deep branch. Extensor carpi ulnaris. The extensor carpi ulnaris is located on the medial aspect of the posterior forearm. Due to its position, it is able to produce adduction as well as extension at the wrist. Attachments. Originates from the lateral epicondyle of the humerus, and attaches to the base of metacarpal V. Actions. Extension and adduction of wrist. Innervation. Radial nerve deep branch. Anconeus. The anconeus is situated medially and proximally in the extensor compartment of the forearm. It is blended with the fibers of the triceps brachii, and the two muscles can be indistinguishable. Attachments. Originates from the lateral epicondyle, and attaches to the posterior and lateral part of the olecranon. Actions. Extends and stabilizes the elbow joint. Abducts the ulna. During pronation of the forearm. Innervation. Radial nerve. Clinical relevance. Lateral epicondylitis. Lateral epicondylitis, or tennis elbow, refers to inflammation of the periosteum of the lateral epicondyle. The peak age of onset is 40 to 50 years old. It is caused by repeated use of the superficial extensor muscles, which strains their common tendinous attachment to the lateral epicondyle. Deep muscles. There are 5 muscles in the deep compartment of the posterior forearm: the supinator, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus and extensor indicis. With the exception of the supinator, these muscles act on the thumb and the index finger. Supinator. The supinator lies in the floor of the cubital fossa. It has 2 heads, which the deep branch of the radial nerve passes between. Attachments. It has 2 heads of origin. One originates from the lateral epicondyle of the humerus, the other from the posterior surface of the ulna. They insert together into the posterior surface of the radius. Actions. supinates the forearm. Innervation. Radial nerve deep branch. Abductor pollicis longus. The abductor pollicis longus is situated immediately distal to the supinator muscle. In the hand, its tendon contributes to the lateral border of the anatomical snuff box. Attachments. Originates from the interosseous membrane and the adjacent posterior surfaces of the radius and ulna. It attaches to the lateral side of the base of metacarpal eye. Actions. Abducts the thumb. Innervation. Radial nerve posterior interosseous branch. Extensor pollicis brevis. The extensor pollicis brevis can be found medially and deep to the abductor pollicis longus. In the hand, its tendon contributes to the lateral border of the anatomical snuff box. Attachments. Originates from the posterior surface of the radius and interosseous membrane. It attaches to the base of the proximal phalanx of the thumb. Actions. Extends at the metacarpophalangeal and carpometacarpal joints of the thumb. Innervation. Radial nerve posterior interosseous branch. Extensor pollicis longus. The extensor pollicis longus muscle has a larger muscle belly than the EPB. Its tendon travels medially to the dorsal tubercle at the wrist, using the tubercle as a pulley to increase the force exerted. The tendon of the extensor pollicis longus forms the medial border of the anatomical snuff box in the hand. Attachments. Originates from the posterior surface of the ulna and interosseous membrane. It attaches to the distal phalanx of the thumb. Actions. Extends all joints of the thumb, carpometacarpal, metacarpophalangeal and interphalangeal. Innervation. Radial nerve posterior interosseous branch. Extensor indicis proprius. This muscle allows the index finger to be independent of the other fingers during extension. Attachments. Originates from the posterior surface of the ulna and interosseous membrane, distal to the extensor pollicis longus. Attaches to the extensor hood of the index finger. Actions. Extends the index finger. Innervation. Radial nerve posterior interosseous branch. Quiz. What is the action of brachioradialis? Elbow extension. Elbow flexion. Shoulder flexion. Wrist pronation. The correct answer is elbow flexion. The muscles of the hand. The muscles that act on the hand can be divided into two groups. Extrinsic muscles, located in the anterior and posterior compartments of the forearm. They control crude movements and produce a forceful grip. Intrinsic muscles, located within the hand itself. They are responsible for the fine motor functions of the hand. In this article, we shall look at the anatomy of the intrinsic muscles of the hand, their attachments, actions and innervation. Thenar muscles. The thenar muscles are three short muscles located at the base of the thumb. The muscle bellies produce a bulge, known as the thenar eminence. They are responsible for the fine movements of the thumb. The median nerve innervates all the thenar muscles. Opponens pollicis. The opponens pollicis is the largest of the thenar muscles, and lies underneath the other two. Attachments. Originates from the tubercle of the trapezium and the associated flexor retinaculum. It inserts onto the lateral margin of the first metacarpal. Actions. Opposes the thumb, by medially rotating and flexing the metacarpal on the trapezium. Innervation. Median nerve recurrent branch. Abductor pollicis brevis. The abductor pollicis brevis forms the anterolateral aspect of the thenar eminence, overlying the opponens pollicis. Attachments. Originates from the tubercles of the scaphoid and trapezium, and from the associated flexor retinaculum. Attaches to lateral side of proximal phalanx of the thumb. Actions. Abducts the thumb. Innervation. Median nerve recurrent branch. Flexor pollicis brevis. The flexor pollicis brevis forms the medial aspect of the thenar eminence. It is described as having a superficial and deep part, although the deep component is variable in size. Attachments. Originates from the tubercle of the trapezium and from the associated flexor retinaculum. Attaches to the base of the proximal phalanx of the thumb. Actions. Flexes the metacarpophalangeal joint of the thumb. Innervation. Median nerve recurrent branch. The deep head is innervated by the deep branch of the ulnar nerve. Hypothenar muscles. The hypothenar muscles form the hypothenar eminence, a muscular protrusion on the medial side of the palm, at the base of the little finger. These muscles are similar to the thenar muscles in both name and organization. The ulnar nerve innervates the muscles of the hypothenar eminence. Opponens digiti minimi. The opponens digit minimi lies deep to the other hypothenar muscles. Attachments. Originates from the hook of hamate and associated flexor retinaculum, inserts into the medial margin of metacarpal 5. Actions. It rotates the metacarpal of the little finger towards the palm, producing opposition. Innervation. Ulnar nerve. Abductor digiti minimi. The abductor digiti minimi is the most superficial of the hypothenar muscle group. Attachments. Originates from the pisiform and the tendon of the flexor carpi ulnaris. It attaches to the base of the proximal phalanx of the little finger. Actions. Abducts the little finger. Innervation. Ulnar nerve. Flexor digiti minimi brevis. The flexor digiti minimi brevis lies laterally to the abductor digiti minimi in the hand. Attachments. Originates from the hook of hamate and adjacent flexor retinaculum, and inserts into the base of the proximal phalanx of the little finger. Actions. Flexes the metacarpophalangeal joint of the little finger. Innervation. Ulnar nerve. Lumbricals. There are 4 lumbricals in the hand, each associated with a finger. They are very crucial to finger movement, linking the extensor tendons to the flexor tendons. Denervation of these muscles is the basis for the ulnar claw and hand of benediction. Attachments. Each lumbrical originates from a tendon of the flexor digitorum profundus. They pass dorsally and laterally around each finger, and inserts into the extensor hood. Actions. Flexion at the MCP joint and extension at the interphalangeal IP joints of each digit. Innervation. The lateral 2 lumbricals of the index and middle fingers are innervated by the median nerve. The medial 2 lumbricals of the little and ring fingers are innervated by the ulnar nerve. Interossae. The interossae muscles are located between the metacarpal bones of the hand. They can be divided into 2 groups, dorsal and palmar. In addition to their actions of abduction dorsal interossae and adduction palmar interossae of the fingers, the interossae also assist the lumbricals in flexion at the MCP joints and extension at the IP joints. Dorsal interossae. The most superficial of all dorsal muscles, these can be palpated on the dorsum of the hand. There are 4 dorsal interossae muscles. Attachments. Each interossae originates from the lateral and medial surfaces of the metacarpals. They attach into the extensor hood and proximal phalanx of each finger. Actions. Abduction of the digits. Assists in flexion at the metacarpophalangeal joints and extension at the interphalangeal joints. Innervation. Ulnar nerve. Palmar interossae. These are located anteriorly on the hand. There are 3 palmar interossae muscles, although some texts describe a 4th muscle at the base of the proximal phalanx of the thumb. Attachments. Each interossae originates from a medial or lateral surface of a metacarpal, and attaches into the extensor hood and proximal phalanx of same finger. Actions. Adduction of the digits. Assists in flexion at the metacarpophalangeal joints and extension at the interphalangeal joints. Innervation. Ulnar nerve. Other muscles in the palm. There are 2 other muscles in the palm that are not lumbricals or interossae and do not fit in the hypothenar or thenar compartments. Palmaris brevis. The palmaris brevis is a small, thin muscle, found superficially in the subcutaneous tissue of the hypothenar eminence. Attachments. Originates from the palmar aponeurosis and flexor retinaculum, attaches to the dermis of the skin on the medial margin of the hand. Actions. Wrinkles the skin of the hypothenar eminence and deepens the curvature of the hand, improving grip. Innervation. Ulnar nerve. Adductor pollicis. The adductor pollicis large triangular muscle with 2 heads. The radial artery passes anteriorly through the space between the 2 heads, forming the deep palmar arch. Attachments. One head originates from metacarpal 3. The other head originates from the capitate and adjacent areas of metacarpals 2 and 3, both attach into the base of the proximal phalanx of the thumb. Actions. Adductor of the thumb. Innervation. Ulnar nerve. Quiz. Which of the following is an intrinsic muscle of the hand? Palmaris longus. Extensor digiti minimi. Adductor pollicis. Extensor pollicis brevis. The correct answer is adductor pollicis. Thanks for watching. Like and subscribe to Anatomy Movement channel for more.